The nursing situation depicted in the simulation showed a young mother in the hospital about to be discharged with a nurse who maybe wasn't the best nurse for her situation. She lacked compassion and she just genuinely didn't care about the patient post discharge. At least it appeared that way. Um, I believe that every person should leave the hospital, have a place that's safe to go if at all possible. I do understand coming from a hospital where we used to have homeless people frequently, that occasionally these people don't have a place to go or they don't want the help that we have to offer them. Some people are more comfortable living on the street, and that's okay. But in this situation, we have to think about not only the patient herself, but the young child that she's bringing home. Um, and in this situation, we have a lot of valuable resources we can use. We can use case management. It seems like maybe they need a social worker involved in her situation because the nurse stated that the patient has a history of drug abuse. So, if we can't help the patient, is there a way we can help the child that was just born? Like, is it safe for the baby to go home with this mother? Is she on drugs now? Did she have a drug screen? And was the baby born addicted to drugs? Was the baby drug tested? Those are all things that I think that we have to take into account. And it's a legal issue if we believe that the mother was using drugs and we didn't test the baby to make sure he or she was safe. Um, Initially, the nurse seemed pretty cold to me. It seemed like she was just very rushed, even when she was just in there talking to the patient, trying to help her do diaper changes and stuff like that. She just didn't really seem to want to be there. It didn't seem like her heart was in it. And as she spent more time with the patient and family, it was pretty evident that she just maybe didn't even know what to do. And maybe that was part of the issue. She felt sort of uncomfortable. Like when the patient said she didn't have a home, she was just like, well, she wasn't like anything. She didn't say anything at all. So that's just really disappointing. She didn't say, like, oh, it's okay, you don't have a home. We will help you find resources. We'll help you find a place to live. There are a lot of resources available to young women with children, especially single mothers. There's things like WIC. Like, she didn't even ask if she had the means to provide this child with food or if she was going to breastfeed. My first thought was, oh, well, she's concerned about her giving diaper changes, which, yes, they are very, very important, but isn't it important to make sure that this baby has food when it gets home? Is the baby going to be formula fed? Do they have formula? Is she going to be breastfed? Does the mother have the means to provide herself with food to create breast milk? You have to be eating something to be producing breast milk. So these are all really important things. I think my first thought, as I'm interpreting it, my first thought would be, what can we do to fix this? I would say we need to make sure that this mom has the means to either care for the child or is safe to take the child. My first thought is, if you're telling me right now that the patient is a drug addict, then we need to test that baby and make sure the baby is safe to go home, meaning that they went through withdrawals. And number two, is safe to go home with the mother. If the mother was doing drugs while she was pregnant, then she's obviously not capable of caring for the baby right now. I don't work on mother infant unit and I don't work in peds. So I haven't really experienced a situation where another person was in harm's way. I have encountered patients that wanted to go home and they weren't safe to go home. And the way that I usually handle that is reaching out to the physician, and usually they're very open to hearing what you have to say. Like, maybe this patient's not safe to go home. If they go home, are they going to come right back? Maybe we need to reevaluate and send them to a lower level of care, like coming from ICU. If we have a patient that can technically be discharged, but they don't have anywhere to go except home, and they're not safe to go home alone, then they'll usually downgrade to like medical or remote tele, and they can stay until they're placed in like a skilled nursing facility or even just a rehab facility. And sometimes that's just a short-term thing, but sometimes it's a long-term thing, and we just have to make sure that our patients are safe when they go home. And I think especially on a unit where there are children involved, I think that we just really need to do our due diligence to make sure that they're as safe as possible, because a child can't help themselves. And again, like, what kind of assessment data would I need? I think I would need her drug screening, and I would make sure that that was negative prior to her giving birth to the child. And I also would make sure that she had a home address, or at least somebody to pick her up. When the nurse asked her if she had somebody to pick her up and she responded her boyfriend, she didn't even let her get the entire thought out. And I just think that this poor girl, the mother, didn't seem to have the resources she needed, and maybe she will eventually, but it seemed like at this time she needed a little bit more help taking care of the child. I think it might have been better to like ask her, if her drug screen was negative, of course, if she had a mother in the picture, or aunt, or a friend, or somebody who could help her with the baby when she goes home, because we can't send somebody home with the baby who has no idea how to take care of the baby. My goal for the patient would be for her to have a safe place to go home, and some basic knowledge about how she could care for her baby. My ideal situation would be that she had somebody who could come help her and assist her so that she can transition into her role as a mother slowly. I think otherwise my concern would be the safety of the baby. And I think this is a super stressful situation for everybody involved. I think that the nurse probably would be really stressed out, but I couldn't imagine being a nurse who sent somebody home in this position who didn't have the resources that they needed. There are so many things that case management can help this patient with, such as, food, shelter. There are places for women like this to go, especially with a young infant. And if I encountered this type of situation, I would say my first thing to do would be to speak with the physician. The second thing I would do is make sure that we get case management involved. And the third thing I would do is make sure that I taught my patient effectively. For example, when she taught her to change that diaper, instead of that being the first time I showed her how to change a diaper, the first time I would have showed her how to do it. The second time I would have had her show me or do it. And then the third time I would have her show me how it should be done. I would also be addressing other things that she would have to know how to take care of at home, like what was she going to feed the baby? Was she going to breastfeed? Did she need help with that? Or is she going to formula feed her baby, and does she need help getting resources to get that formula? Also, it seemed like she didn't really know what was going on as far as being a new mom, so she really needed to make sure that she had a follow-up appointment with the pediatrician to make sure that her baby was gaining weight appropriately, just like everyone does, just well checks. And additional knowledge I would say that I need for this type of situation is, I really think that a knowledge of like a labor and delivery nurse and their process to discharge would be beneficial for me. I haven't ever experienced this situation personally, and I hope that I don't. But in this situation, I know that what I would do first would be reach out to the physician. Usually they're pretty open to your feedback. And secondly, I would reach out to case management because they are really a wealth of knowledge. Changes in my values, it just shows me that people really do need help, and we are here to help them. And I I want to make sure that every person goes home with their baby and knows what they need to do. Maybe they need to get some kind of like a nurse's aid or something for people who are unexperienced, because we want to make sure that these babies don't die from things like SIDS. And in this situation where the mother didn't know how to change a diaper, I'm sure she didn't know how to prevent SIDS.